Welcome back to the Build Beyond podcast. I'm your host, Chris Netley. I created this podcast to help challenge and guide people. The idea is to challenge and guide you so that you can reach your full potential. I want to talk today briefly about a conversation that I had today with a patient. This is going to be a really short podcast. I thought this was a really positive conversation. And I think what came out of the conversation, the aha moment that this patient had, I think it's valuable. I'm going to protect this patient's identity as much as I can and try not to give it away so anyone knows who this person is. But this is a young man who had some issues. He's a young athlete. He had some pain in a very specific joint and it concerned him. He's a multi-sport athlete, but really leaning towards one sport. He was not in his primary sport at the time when he sought healthcare. So this was sometime last spring. He went in and he saw a healthcare provider who he trusts, who his family trusts. And this healthcare provider is not it's not someone who specializes in sports medicine, we'll put it that way. So the recommendation was, I think, pretty logical actually. Initially was, well, why don't you rest and see what happens? So go and take some time off, and we'll see if the pain decreases or goes away or sticks around. And so this young athlete, he did that. He rested, and things didn't get better. Actually, in many ways, they got worse. So the healthcare provider kind of doubled down and said, okay, we were kind of doing partial rest, but let's do complete rest. Like you're not going to do anything. And so that prolonged rest started to have negative effects on him mentally. So he was away from his teammates, and his parents noticed that he wasn't as happy. So he was showing signs and symptoms of depression, although it probably wasn't clinically depressed. And there were some other healthcare issues that popped up. But you have to understand, this is a young person who is a team athlete who is usually incredibly active and now has gone from a ton of activity from as a teenager would, a young multi-sport athlete, and he's gone from all of that activity to zero activity. Not only has the activity decreased, but he's been pulled away from his social groups, from his friend groups. Not that he doesn't see them at school, but he's not interacting with them in sport as he normally would. So his life has been really turned upside down. So at this point, he actually went to his primary care physician. His parents made him go because he was starting to have other health issues, and they thought this was weird. The primary care physician also thought it was weird and was intuitive enough to see, like, well, there's been a huge, I know we're talking about specific joint pain, but look at this huge shift that's gone on in your life. And at that point, the primary care physician was like, I don't know if rest is necessarily the best thing for you, because obviously the pain's not getting better. And I think a lot of these other issues have to do with a decrease in physical activity and some other mental health issues that are reaching the surface, things that you've never had before, because you're not with your friends and you're not competing as you normally would. So this primary care physician actually recommended that he get back into physical activity, which contradicted with what the other healthcare provider said. So they trust the other healthcare provider. They went back. This person doubled down. Said, no, I recommend rest. You can do whatever you want essentially, but this is my recommendation. Now, again, this is my understanding of the situation. I wasn't there for any of these conversations. So at this point, they went back to the primary care physician. Primary care physician actually recommended that they talk to me. I got a pretty good had a pretty good conversation actually. This PCP actually called me, and we talked for quite a bit about the patient, about everything that was going on, and what the primary care physician had suspected as far as a diagnosis and what she was thinking as far as treatment goes. So she wanted me to do an evaluation and see if I concur, which honestly I did. It was not a complicated issue, but definitely a frustrating issue. And based on the history and the exam, this person was ready to get back into sport, and pretty quickly. So we started, crawl, walk, run. Phase 1 or part 1, we got to make sure that we taking care of the symptoms. It had been enough time, so that was pretty easy. We got through that pretty quick. Phase 2, which we're I guess technically still in, we're testing for weaknesses. So we're going to progressively make this harder, and we're going to hit this joint and these muscles from as many different areas as we can. So we're talking about strength, stability, mobility, flexibility, complex movements. So power, looking at agility in different directions. And then we're looking at how does the whole system function when we jack up the heart rate? So when we really stress cardio and then we go in and test the joint, what happens? What happens in not just sprint work, but lateral work, and just trying to hit this joint from as many different angles as possible with as many different stresses as possible to try and mimic sport, to see, are there any weaknesses? And once we find those weaknesses, how do we address them and make them, they don't have to become strengths, but we make sure they're not weaknesses. In addition to that, we're looking at all of the other things that this athlete would want to do. So if he's weak in other areas, you know, so we can work on that, right? So if someone's got a knee injury, we might as well be working on upper body stuff. Or if someone's got an upper body injury, we might as well be working on lower body stuff, working on cardiovascular, working on mindset, just getting them back into that athlete mentality, getting them back running and playing and participating in sport as much as they can. So just incrementally moving them back and trying to identify weaknesses and then address them and move on and keep moving forward. So that's the progress that we've been on. Now, here's the interesting thing what happened in the conversation today. I follow up with my patients in between visits. So I had reached out and I'd asked, how are things going? And I got a text message back saying, I woke up in pain. And I said, okay, well, you know what to do, essentially. Like, we've gone over, he's got a list of mobility drills that he has used to help stretch and mobilize and decrease pain quickly. He's got a list of exercises that we've been doing that have worked well for him. So I said, just, go back, look at this is an opportunity to see if you can manage it yourself. So I ended up, didn't hear anything back, assumed everything was good, saw him today, and he said, it was this really interesting situation. So he was in bed at night, and all of a sudden the pain came back, and it hadn't been that bad in a long time. Seemed to come out of nowhere, had no idea. Was able to go to sleep fine. Woke up, decided he was going to be active. So he went about his day. He started moving, ended up being pretty active, playing some recreational sports, ended up hitting the gym and lifting, and ended up going on a run throughout this day. And by the end of the day, the pain was completely gone and it didn't come back. So he wanted to know, like, what would happen there? Why would I have, out of the blue, such intense pain that almost seemed like a regression back to the beginning? And then when I woke up, I still had the pain, but I was able to use movement, not only to manage the pain, but to actually get rid of it and be able to do all the stuff I wanted to do. He had fun, he lifted, and he ran. So it was a pretty good day, and what seemed like should be a really bad day. Now, the answer to that question, it's a good question. It's a simple question, but the answer is quite complex. And I think the answer to that question is probably somewhere in the middle of what I'm about to describe. So just from a pain management standpoint, if you've ever stubbed your toe or jammed your thumb, and you've hopped around on one foot or you're shaking your hand, then you understand that at times when you're in pain, you compulsively move more. And that's a way that you kind of manage pain. It feels a little bit better. We know that pain travels slower, like through the nervous system, than movement, right? I'm not going to go into a neuroscience lecture. So this is a really simplified version of it. They generally travel on different fibers. That signal that causes pain is slower than the fast moving movement signal. There are theories to what happens in the brain. One theory is that the movement, because it's coming in so fast, actually cuts off that pain signal. I think I've seen another theory that the brain just prefers the movement signal, so it kind of lessens the pain. But pain is really like the concept of pain is really in the brain. So those tissues can send signals all day long, but your brain decides, if it's going to be painful or not. And that's why things like opioids can be so effective, is because they go to the pain center. So you could have like a long bone fracture, an open wound fracture of the leg, incredibly painful, and you can get some morphine, you know, and you might not feel it. It might not be painful anymore. It doesn't mean that the tissues, those damaged tissues, aren't sending signals up to the brain. It's just the brain's just kind of like, yeah, it's not that painful. So the brain is pretty powerful when it comes to how we interpret pain. And for some reason, movement helps manage pain. So when I think like, okay, you went to bed in pain, you woke up in pain, and then you decided instead of resting, you moved throughout the day, and that made you feel better. I would suspect that there is some type of neurologic component to it, so that natural painkiller. On top of that, we know that movement helps with different neurotransmitters in the brain. This is an interesting thing because I bring this up in lectures for my physical wellness class at college. A lot of what we know about what exercise does for the brain, we know about research for depression medication, for SSRIs. So I may get this history not completely accurate, but it's my understanding that we found SSRIs and all of those kind of daughter medications on accident. So there were different drugs, they were trying to treat different things, and then they would notice like, oh, this person who we're treating for whatever disease with this drug is getting inappropriately happy. And then they would notice that was a common trend for people who take the drug. So then they would apply it to people with depression, and they would see, oh, it would help. So then what they did was they reverse engineered the drugs, and they noticed that it was affecting neurotransmitters. Serotonin's a big one, dopamine, norepinephrine, I think it's another one. Anyway, so you've got these neurotransmitters in the brain, and it affects them. So I think then in research, when you're looking at trying to get a new drug on the market, you have to compare it to something. So exercise is a common thing to compare it to, and you've heard of the idea of like a runner's high. So everyone's a lot of people have experienced that. You go out and you move and you feel better. Well, then they realized when they look at neurotransmitters that exercise and movement can affect neurotransmitters in a similar way to these prescription medications. I'm not here to say that exercise is better than medications, and I'm not here to say that medication's better than exercise, and I'm not here to say that you can't use both or that you shouldn't use one, or I'm not making any comments on the utility of this. I'm just saying that this is what I've read, that this has been observed. And I think most people have experienced some form of runner's high where you're not feeling great, and then you go out and you move and you feel better. It's not just about pain, it's about your mood, right? Moving usually helps people improve their mood, and they feel better, and they have more energy, and usually movement involves social interaction, so you're around people. So I think my patient, he had the benefit of moving more and having that neurologic benefit. I think he had the benefit of moving more and boosting some of the neurotransmitters in his brain that make him happy. So like dopamine and serotonin and all these different things. So he had that aspect. On top of that, he had the benefit of having some type of agency. So he basically, instead of losing control of the situation, he regained control. And I don't know if we can measure that benefit, but there was an idea of, I'm not helpless. I've been through this before. I'm not going to die. I know what to do. I'm going to do these specific things. And if this doesn't work, I'll try this. And if this doesn't work, I can try this. He's got this toolbox now that he's been developing. And so there's that sense of agency. On top of that, you get all of the social interactions. So you're back with your friends. You're not missing out on anything. So you don't have to deal with any of those negative effects. And on top of that, you are living your life, and you're doing everything you want to do, and you're still working towards your goal, because he has a goal. He's got a sports season coming up, and he's trying to get back to that. So then there's that good feeling. So when we look at like, well, why would he feel better? I think you have to consider all of those factors. You've got the neurologic pain numbing benefit. You've got the neurotransmitter benefit, the runner's high, the serotonin, the dopamine. You've got the benefit of having agency and control and not feeling helpless. You have the benefit of having more social interactions and being with your friends and all of those benefits. You have the benefit of working towards a goal. So I think all of that probably contributed to the pain going away. Now, the interesting thing, let's say we had two athletes, same demographics, same injury, went to bed with the same symptoms and woke up with the same symptoms. My athlete, he did what he's supposed to do, and he got all of those other benefits. Maybe the other athlete is seeing a different healthcare provider who's recommending rest. Again, not trying to talk trash about other healthcare providers. I really don't like those recommendations. I think they're well-meaning, but ultimately, I don't think they do a lot of good. So we've got this other athlete doing rest. So basically, the tissues in the body have not changed. Like the same injuries, everything's the same. My athlete goes that direction. He does everything that he's been working on that he knows to do. And at the end of the day, he has no pain. And he's had all of this fun and accomplished all of this stuff, and he's worked towards the goal. The other athlete, instead of going out and joining in on all of that, decided to stay home. So he didn't get the movement. He didn't get any of the benefit of the exercise. He didn't get any of the benefit of the neurotransmitters. He didn't get any of the benefit of the social interactions. He did not work towards a goal and all those different things. So at the end of the day, almost identical athletes, same diagnosis. One athlete is pain-free and feeling great. The other one still has pain and is not feeling great. So it's a totally different outcome, all based on basically giving someone the license and the freedom to move and encouraging them to move, and then guiding them on the path to what movement it's going to be the most beneficial for them. It's not about like good or bad movement or right or wrong movement. It's different for everybody, and it's different in different stages of life. It's different for different sports and different injuries. And that's why we build a toolbox so that the athlete has a variety of things to pick from, because the stretching and the movement and the mobilization and whatever you're doing yesterday that worked might not be the best thing today. So you've got to have a plan B and a plan C. You have to have some type of variety, because if you just do the same thing over and over, it might actually start causing pain in and of itself, because you've got this repetitive process and you don't have enough variety. So that could be a problem too. So that's what I wanted to share with you today. I think the light bulb, as I explained this to him, or at least my thoughts on it, I think the light bulb turned on, and hopefully it gave him even more confidence. I think he should have a ton of confidence. The interesting thing is that, like, I have done very little in this process. I see him once a week, and so for an hour. I don't know how many hours there are in a week, but the amount of time that I spend with him is this much. And then he gets a call or a text message in the middle of the week, and we might talk, we might not talk, depending on how things are going. So most of this work, over 99% of it is stuff that he's doing. I'm just guiding him in that direction. But now he has this experience, and he's starting to fill it in with a little bit of understanding. It's like my 6-year-old son watched The Karate Kid, the original one, for the first time. I don't think he quite grasps the whole thing, but he loves the fight scenes and the training scenes. I like The Karate Kid for a lot of different reasons. I mean, I grew up on it watching that, but Mr. Miyagi, his teaching method, I think is brilliant. And it's kind of what I use with students. Although when I tell them this, I usually have to explain the plot of The Karate Kid, because I'm 43 and most of my students are teenagers and they have heard of it, but a lot of them haven't seen it. So Mr. Miyagi, if you remember, a big part of the movie is Daniel needs to learn to fight, or he feels like he needs to learn karate. Mr. Miyagi reluctantly decides to teach him. And then Daniel shows up to train, and he has him wax his car, but he has to wax it in a very specific way: wax on, wax off. So he does it, and he comes back the next day, and he just keeps giving him chores. So he has to paint the fence, side, 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 paint the house, up, down, sand the deck, do all these different things. So after several days of doing this, Mr. Miyagi comes back from fishing, and Daniel blows up, gets really upset, says, "You're not actually trying to teach me anything. You're just trying to get me to do chores for free." So Mr. Miyagi has him show him the movements that he's learned, and he starts throwing punches and kicks at Daniel, and Daniel instinctively starts doing wax on, wax off, and paint the house, paint the fence, and sand the deck. to block the punches and the kicks, showing that he actually has been learning the whole time. Now, Mr. Miyagi understood something, I think, very important about teaching and learning. If someone has no background, then you could tell them anything you want and teach them anything you want. It's not going to stick. But if they start to develop an experience, and it's easier then to add knowledge later. And so I think it's not exactly how I deal with patients, because I do try and get some knowledge out there in front, even if it doesn't stick, because people need to make healthcare decisions early on and they need that knowledge, and I can't just sit on it. But to the greatest extent possible, I do try and give people an experience and then fill in information on the back end. I had never even planned on having this conversation with him. He just asked, and I thought it was a good time to throw in a little neuroscience and throw in a little bit about neurotransmitters and stuff like that. And I think it all clicked because I was basically giving him some information and connecting it to an experience that he is currently having. And it was like, oh, I get it. And I will say, and I've said it before, I'll say it again, the way I described this with the neuroscience and all that stuff is probably not incredibly accurate. I'm oversimplifying it on purpose just for this podcast, because I'm not really talking to other healthcare providers, even if you're listening. I'm trying to make it so people without a background can understand, or at least have an idea of what's going on. So I hope that conversation is helpful. And if you have questions about things like that, you can reach out and ask. I'll do my best to answer them or get you to someone who can answer it. All right. Thanks for tuning into this episode, and stay tuned for next week's episode.